discriminative individualistic symptoms. So I felt that during my experience, 25% is something about aura of the doctor many of the time, and 25% is the interaction and the satisfaction, how patient gets satisfied by you, something like psychosomatic conditions or something what we call the placebo effect sometimes, and 25% based on examination and diagnosis, because many of the patients nowadays, they have got the Google answer already. So they will be very happy once their Googled diagnosis and you have diagnosed matches. So they will also be happy, and you also happy that you have diagnosed the patient properly. So many of the patients will be happy or partially better when they came to know what is their problem. For example, patient may come with some headache and you tell that it is frontal sinusitis, you tell that it is classical migraine, you tell that it is because of your cervical spondylosis. So once you give some diagnosis for the patient, they will be somewhat happy. The people, especially those who are knowledgeable, those who are educated, that they came to know what is their problem. And to add to that, even in every disease, there is something called as uh, symptoms and signs and pathology and the diagnosis and lot more. According to me, the pathology and the prognosis of the condition is very important, so that we can make out whether our treatment is going in a right way or not. So when we treat some surgical cases with homeopathy, we have got so many scopes, so many limitations. I can tell you directly here that I may not be in a position to tell that I will cure a case of cancer. So, or I will not be in a position to tell that I will cure a case of fracture, because it may be a limitation for me, or according to my knowledge. So there are so many scopes. According to me, around 70% of the cases or 80% of the cases really can be treated, and surgical maybe around 50-50. So I have put some cases, though I may not be able to discuss all the cases because we have got hardly 1 hour time. So let me share some ideas which all cases can be treated or cured with homeopathy, which are otherwise surgical. Means if the same patient goes to allopathic sector, they will refer him to surgeon or maybe dermatologist, etc. And it's a case of surgery, but surely we can treat very nicely, easily, without very much scar mark with the homeopathy. I have put the list. This is my list, starting from head to foot. Just an idea. Starting from scalp abscess, normally incision and drainage is the treatment for any abscess, and chalazion and stye, what you get around the eyelids, and then nasal polyp. It's one of the common condition. Once if it is removed also, polypectomy, it may come again because it's common in allergic people. So they surely won't give any guarantee for nasal polyp cure. So surely once it comes regularly, why you want to operate it? Then is sinusitis. Again, it's a drainage treatment in allopathy. We have got excellent remedies which will help permanently. And adenoid hypertrophy, one of the very interesting conditions, otherwise surgery, because adenoidectomy is the treatment in allopathic sector. But adenoid is one of the immunity factor because it's a lymph node, and we have so many lymph nodes in our body, including the tonsils, which are really the fighters of our body against the antigens, and they protect our body. So surely adenoid hypertrophy, what we call commonly adenoids, it's a lymph node, so we can treat easily with the homeopathy. Oral mucocele, one of the small condition, but still they remove it surgically. Tonsillitis and tonsillar enlargement, one of the common bread and butter of ENT doctors. What happens after removal is secondary to them, but once it is enlarged, they think that it is causing the problem. But once you remove it, surely the infection will go directly. Whenever the tonsils enlarge, it's a lymph node. They are the policemen of the upper respiratory tract, so we need them. And then CSOM, one of the ear condition, chronic suppurative otitis media, where the middle ear gets infected and the pus usually start coming out, breaking the tympanic membrane. And there are two types, aticoantral and tubotympanic. Some are offensive, some are non-offensive. But in allopathy, it's a surgical treatment. In allopathy, ENT specialist will do. But again, it may recur. There may be hearing defects. So in children, we have got a very good result for CSOM. You just prevent the further repeated infections of middle ear, so that the ruptured tympanic membrane also may heal back. It may not be possible in adults because the tympanic membrane will be little bit stiff, whereas in children it will be a bit soft and it may refill. And coming to goiter, I put one case. So goiter, it's a basic or simple enlargement of the thyroid gland. Normally, they remove when surely they will remove when it's a cancer. Surely it need to be removed if it's a cancer, but they also remove when it is large and asymptomatic. So normally they also remove in case of hyperthyroidism, because as the gland has enlarged and it is producing more secretion, like especially T3 and T4, so they may remove it. But again, we can treat such conditions with homeopathy. And sometimes when T3, T4, TSH, what we call the thyroid function tests are normal, only the person has got something called simple goiter without any complications, without any effect on the body. It looks bad, then they remove it. But once it is removed surgically, surely such people need some thyroid tablets like Thyronorm or Eltroxin or Thyroxin permanently, at least till the age of 50, because the hormones has to be supplemented. So such cases surely we can treat with the homeopathic medicines. I don't want to discuss about the medicines because that is individualistic, and that is how we give importance to person as a whole. So I have a lot of specific medicines starting from thyroidinum spongia, bromium, calcareflor may be there, but that part I don't want to discuss at present. Next is salivary calculi. I had 2-3 cases of interesting salivary gland calculi. I have one calculi with me also. If possible, I'll show you. And where the patient had a calculi in the submandibular salivary gland, they in the X-ray it is being found out, and the patient had dryness of the mouth because of the obstruction of the salivary secretion because of the calculi. It was a retention calculi, and they tried to open orally. They could not do it. They had to do submandibular way. But that time the patient visited to homeopathy, and I had given something like a calcareous sulf and Merck's salt and some constitutional medicines, and it had worked out nicely. Uh, so we are trying to avoid surgery which are easily treatable with homeopathy. So next case is the frozen shoulder or capsulitis or rotator cuff syndrome, one of the common surgical intervention done by orthopedicians, where the person is not able to move the shoulder due to various reasons. It may be capsulitis, it may be rotator cuff syndrome. So usually they give, initially they try to give one steroid injection into the shoulder, and even after that it's not better, they give option for the surgery. So this can be treated with homeopathy along with some physiotherapy or some exercises. Next is CTS and TTS. This is what we call carpal tunnel syndrome and tarsal tunnel syndrome. Carpal tunnel syndrome we see in median nerve compression in the upper limb. Normally the compression occurs at the level of wrist, where the patient will have usually the numbness of 2 or 3 fingers, and normally it is one of the most simple surgery by neurologists or neurosurgeons, where a small incision is being made near the wrist in the flexor aspect, and the nerve compression is being released, and again it is stitched back. But remember, it's common in hypothyroidism and in obesity. So at any point of time in their future, surely they can get it again. So next is tarsal tunnel syndrome, bit rare, but it is happening in the lower limb. Next is the trigger finger, where the tendon or fibrous sheaths of the fingers get stiffened, where the person is not able to flex or extend the finger completely. So in this condition, usually they do a small surgery in the palm and release the tension. So this also can be treated with the homeopathic medicines. Next is once we go in a little more downwards, intestinal obstruction. In the initial stages, when the person is able to bear for a day or two, surely we can try something with the homeopathic medicines. Unless the patient is unconscious or severe vomiting going for collapse, even may lead into hyponatremia, or such conditions, we may not be able to. But if the patient is able to withstand for a day or two, surely we can try with homeopathy. And ulcers, fantastically we can treat with homeopathy. I'm talking about intestinal ulcers. It may be some, that's what we call something like IBD, intestinal bowel disease. It has got two types of ulcers we call Crohn's and ulcerative colitis. Both are very nicely we can treat with homeopathy. And ulcerative colitis is more dangerous, but Crohn's is chance of relapse is there, and nice treatment is there with homeopathy. Without any surgical intervention, we can treat it. And even intestinal polyposis, we may have to be little bit careful, because polyps can be precancerous. So we have to see whether once you do endoscopy or colonoscopy and take out a tissue and send for biopsy, we have to just see whether it's turning or not. If at all so, we may have to go for surgery, but otherwise we can treat if it is a benign still. Then one of the common sector where homeopathy works good very nicely in surgical is the hemorrhoids, fistula, prolapse, and fissures. Fissures are not purely surgical conditions, because already there will be a crack. But prolapse, yes, and fistula, very common. Surgery is being done, and hemorrhoids also very common. So these are the field we have got a very good treatment, including in hemorrhoids. But usually prolapse and hemorrhoids, as per my experience goes, first or second degree hemorrhoids or prolapse we can treat. But once it is always out, always there is a chance of infections, so that we have to be taking care. That's what I have told in the initial page. Always pathology and the prognosis of the condition is very important, whether we are going in right direction or not. Because when we treat this type of surgical cases, we have to be remember that after a gap of time, like I mean, for example, you are treated for a month or two where the condition becomes worse, then you refer it to allopathy, then they will surely blame you, or even they blame the system, because you have already wasted 2 months of time. So it's always you have to be remembering the prognosis, whether we are going in right direction or not. Then coming to the gallstones, here also you have to be very sure. We have got wonderful medicines for gallstones, what we call the cholelithiasis. Many of the time patients will come with cholelithiasis with cholecystitis. Whenever there is inflammation, we call it as cholecystitis. Whenever there is only the calculi, we call it as a cholelithiasis. So in these conditions, normally, as I told, we should know the symptoms, we should know the signs, we should know the pathology, we should know the prognosis. So we should know what all type of calculi can come. Normally we know it's very commonly it's either pigment stones or the fat, or what we call the cholesterol stones. So usually the reasons for this is sudden weight gain or sudden weight loss also. So where the sedimentation occurs and leading to gallstones. So it is very common in females. We know 5F common in female fertile fat, fertile time. But we have to be knowing that if it is asymptomatic, we need not really worry it, means we need not really treat it. But if there is a cholecystitis, we have to treat it. But otherwise, and in men, we need to treat it, because very important and very rare, and it may lead into problems. But whenever we treat gallstones, we have to remember that usually from the gallbladder, the opening is into the second part of duodenum. But once in a while, when once it comes in the bile duct and later into the common hepatopancreatic duct, sometimes the calculi may go back into the pancreas and may block, leading to diabetes and even the recurrent pancreatitis, which is very risky. Recently I had one case where the patient had multiple gallstones, and after 1 week of time patient came with the jaundice. Reason was the calculi went down and it blocked in the bile duct, where it led into obstructive jaundice. So in such condition, if at all we are able to treat in a day or two, because these are really surgical, if you are able to treat, manage the patient, because the patients also may have severe vomiting, so we can continue. Because once the blockage goes, surely it will go into the GIT, then surely there will not be any problem. Next is one of the best area I can say is the renal, uretric, and bladder calculus. So renal calculus, we have to be very sure what type of calculus it is, because usually 5 types of calculi are there, where common are calcium oxalate and triple phosphate. The calcium oxalate stones will be irregular, usually it will be painful, and usually size varies from 5 mm or 3 mm to even to the 15 mm, 20 mm also. But the second type we call triple phosphates. Usually it will block in the pelvis of the kidney. Then we call it as a staghorn calculus, which is very difficult to treat. And whenever you treat this type of cases, we should know that uh, uh, patients' kidney functionings are normal. So always we have to assess. That's what I told, prognosis. And usually in the renal failure, we have to give importance to three things. One is blood pressure, second is hemoglobin, third one is serum creatinine, along with the urea and blood urea, nitrogen, lot of other things. But basically, it is the blood pressure, hemoglobin, and serum creatinine. If these three things are within control, surely we can wait for little more time, even though calculi is larger, because we know that though we have got both two kidneys, one kidney functioning properly is also sufficient so that patients may not get any complaints. So uretric, once it comes down in the ureter, once after the kidney, so then it has to pass out very easily. Once it comes to the bladder, usually it will pass out easily, and it is easier in females than in men, because in males the urethra length is more. Then coming to the ganglion, I will show you what is ganglion. Usually it comes in the forehead or in the temples or in the foot or in the wrist. So one small growth in the nerve. Usually it's surgical, very small incision and treatment, but still we can treat with homeopathic medicines. Next is the skin tumors. Very commonly, you know, it's a wart and corns and ulcers. So these are the conditions which are easily treatable. I'll show you some cases. I put the photos which you can, I mean, which you can make out, because tonsils and throat and goiter and hemorrhoids, etc. There is no point in showing the picture. Reason is we may not be knowing whose pictures there, or you can make out very clearly the good prognosis. Then is the fibroids. In breast, we call fibroadenosis and fibroadenoma. Two types are there. There are so many types like phylloid tumor, carcinoma, etc. But fibroadenoma and fibroadenosis, these are the two benign type of tumors of the breast, surgical otherwise, but we can treat with homeopathy. And uterine fibroids, very common, very challenging. And I will show you one case, what to treat, what not to treat. And hernias in first and second stage, even though it may be inguinal, it may be umbilical, it may be femoral, it may be incisional, any type of hernia we can treat with homeopathy. And last one is hydrocele, that is enlargement and fluid accumulation in the scrotum, and also the varicocele due to the pampiniform plexus of veins enlargement, where there is a more circulation into the scrotum and the testicle. Usually the people come with the sperm motility or infertility. So I have put these cases, just names of the disease, so that everybody can make out these are really the scope of homeopathy in the surgical cases or surgical cases otherwise, but we can treat with homeopathy. There may be many more, but I have experience in this, and I felt these are easily treatable instead of surgery, so I have put them. So now I am showing you some cases so that you can know how homeopathy works. So you can see here one case. I am putting some cases which are rare. You can see there is a chalazion where the patient has got one tumor-like collection over the eyelid, and you can see the second photo where it is gone. So usually we have got wonderful medicines, like starting from arsenicum album, hepar sulf, calcareous sulf, silicea. You might have heard about. So we can easily treat, but very importantly, unless if the patient is having recurrent problems, then better to take constitutional. But if the patient comes with acute conditions, we may have to take acute totality and treat. So in such condition, when the patient comes with the problem presently, present condition can be treated first, later we can prevent the recurrence. And this is one of the rare case. If you are able to see, it's a cyst of the palpebra, and you can see the picture. where the patient had sent. This is the recent case, I think a month or two. And the last case, last picture you are able to see, it is gone. Actually, it ruptured and it went. So it was going on enlarging. That's why patient came. And when we treat this type of cases, we should know what it is. We should know what is going to happen, because this patient surprisingly was a close relative of an ophthalmologist, and he told, you just come one day, we will just remove it. But he did not wanted to. Reason was it was near the eyeball and he was a bit afraid of. So I think in a day of 4 or 5 it got cleared. And this you can see, these are the conditions where they are asymptomatic and non-inflammatory, because already the infection is gone, it has formed into a tumor or a cyst. Sometimes when the patient takes some antibiotics when there was a boil, sometimes we call antibioma, where it becomes hardened and it will remain permanently like this. In such condition also we can treat very nicely with homeopathic medicines. Next is the carbuncle. You can see this is one of the recent case. You can see this is the case where patient had, this was around 4th or 5th time, same area patient had the carbuncle. And if you are able to observe very clearly, there are 2-3 openings. That's why we call it as a carbuncle. And I had given some medicine, and within a week of time, that was the second picture, and by 3rd week it opened, and I told it to clean properly, because even little bit of pus remains also, once again it will form into another carbuncle in soon. So last one was almost the healed, and after that there was no symptoms, and almost the carbuncle was cleared out. And this is a case of small abscess. You can see it is present at the area of uh, uh, vaccination. So it's common. Sometimes it will vanish by itself. We need not treat. But as it was led into pus formation, they told to do IND. But I had given a single dose of Heparsal for 30, and within a day it cleared out. So sometimes without medicines also it may clear out. Sometimes just a hot fermentation may be sufficient, but it was a small baby, you can make out. So sometimes hot fermentation may be difficult to give. I am putting this case something rare, because normally we see goiter very commonly in females, or in females, out of 10 cases or 100 cases, sometimes 98 also will be female, because in females goiters are common, hypothyroidism is common, hyperthyroidism is common. But in males it is common, it is rare and more risky, because it may turn into malignancy also in men, whereas in females it is common and usually non-serious, means it may not turn serious in future also. But whereas in men it is rare but risky. So I have put one case, a case of goiter. I can put one more case, but you may not be knowing whose photo it is. Reason is, normally, whenever we take a photo, we don't take the photo of the face, because we have to prevent the identity or sharing of the identity. So I have put one male goiter, so that we should know that male goiters are always risky. So whenever you treat a case of goiter, there are normally 3 investigations what we do. One is called thyroid function test, what includes T3, T4, and TSH, the basic, out of which the T4 is more important. Next is the T3 and the TSH. And there are so many tests, like you have got anti-TPO, we have got free T3, free T4, etc. So these are a little bit next level investigation. Second is ultrasonography of the neck, the thyroid gland, so that we will understand what is the size of the thyroid gland, whether what is enlarged, etc., whether there is a cyst, whether there is a tumor, whether malignancy, etc. And normally the specialty of the thyroid cancer is that thyroid cancers are usually seen in adolescence. Same like the blood cancer, the bone cancers are seen in childhood. The thyroid cancers are common in adolescence, not like any other cancer which comes in after 40s or 50s. And third is the FNAC, where the fine needle aspiration biopsy is being done. A puncture is being done into the thyroid gland, and the liquid is being removed to find out what is the material. And always, whenever it's a cancer, better to remove if there was a no spread, so that patient will live for longer time. The renal calculus, I don't want to put the common calculus of 4 mm, 5 mm, 6 mm, or 8 mm. In my experience, I have treated some complicated cases also, because normally when patients come to me, with this, always they have already undergone 1 or 2 operations like ESWL, etc., lithotripsy, or already they have taken some treatment but nothing worked. So I am putting some cases which are larger calculi. So always you can see normally below 5 mm or below 6 mm calculus, usually medicines also not necessary, because what we call the hydrotherapy, it just by drinking water or barley water, etc., calculi may pass, and usually uric acid calculi also will be usually smaller, so it may pass by itself. But larger, especially the calcium oxalate or triple phosphate larger than 6 mm may need treatment. But usually up to 8 to 12 mm, also it's easy with the homeopathic medicines. But always when you treat this type of conditions, you have to remember that whether patient's kidney functioning is normal, whether the creatinine is normal, BP is under control, we have to check always. Right. So I'm just putting a case where you are able to see this scan report, where there is a large calculi of 22 mm, 5 centimeter distal to the pelvic uretric junction. So you can see it's a large calculi. Already it has come to the ureter, and normal ureter diameter is about 5 to 6 mm, and in this 6 mm, 22 mm sized calculi is blocked. So usually after this, it's a bit difficult to crack it, but still we have to try. So normally, for these conditions, allopathic treatment is lithotripsy. It will cost about 1 lakh. But with homeopathy, we can try at least for a month or 2, where once it breaks, it may come down, and once it comes to bladder, it is easily removable, or it may go by itself. So I'll after 2-3 cases, I'll show you my recent experience, which happened a week back. So you can see patient is also having gallbladder calculi along with the kidney stone, along with the uretric stone. So always, if the patient is able to bear the pain, severe vomiting, same patient you are able to see, previously it was about 22 mm, and later it has become around 19 mm. Probably 1 mm and 2 mm does not make a difference, because size of the calculi measurements sometimes vary. If it will not be round, so that all diameters will be of same measurement. Sometimes 9 mm and 10 mm does not make a difference. So we need not be happy that on 10 mm became 9 mm, or 10 mm became 8 mm, because sometimes the variation in the measurement makes a change. But if it is more than 3 mm, surely it indicates that possibility that some piece might have gone. Once some pieces have gone, the original calculi become smaller. Okay, so now you are able to see lot of calculi in this patient. You can see pelvic junction 17 mm. Usually, once it comes to the ureter, it indicates that we are able to treat. But if it does not come at all, it is fixed at the pelvis, it may be a staghorn calculus. According to me, it's a bit difficult to crack. Right. So you are able to see one more calculi, 10 mm, multiple calculi in the kidney, and even there is a big calculi in the ureter, sorry, in the urinary bladder. So lot of calculi. This type of patients may need around 6 after the other. So always, that's what I'm telling you. So measurements are important, but not always. And sometimes pain, sometimes painless. Sometimes, though the patient may have pain in the left side of the abdomen, calculi may be present in the right side. So reason is same level of spinal cord, it may give pain. Same like that appendicitis, though it is present in the right side, sometimes, rarely, patient may have pain in the left side of the abdomen also. Same like heart attack, patient may have right side pain also. So sometimes we may not be, automatically we will be able to know. Now you are able to see proximal ureter, and previously if you are able to see same patient, there was a urinary bladder calculi. I hope you are able to see, but now it is gone. You can see urinary bladder is normal, but still lot of calculi still coming out. And remember, these two are with the gap of just 15 days. So still two calculi are coming down. So it will take time, but surely it has to. I'm putting one more case. You are able to see lots of calculi. You are able to see 15 mm, 6 mm, 10 mm, and 4 mm at different levels. Calculi has gone. You need not take a scan again. And sometimes when the calculi comes down, the bleeding. So sometimes basically one urine test which costs just 50 rupees will tell you whether calculi is still there or not. Because usually in the urine, if the pus cells are normal, one of the reason is calculi. I won't tell that it's only calculi. It may be a cancer also. It may be a rupture of renal cyst also. But commonly it is calculi if the patient had already history of calculi. This is the same case. You are able to see the patient name Vishwanath, and you can see same. And now some of the calculi are gone. So you are able to see one in the left proximal ureter 14 mm, but whereas two calculi have already gone. So this is, I'm just putting the cases. If you have got any doubts, I'm sure I will show it again. We can have a discussion. This is the case which happened around 2 years back. One of the memorable case I can say, because you are able to see this calculi. Already the patient had one surgery in the left side, but this was the right-sided calculi. The problem in this patient was there were two ureters connecting right kidney to the bladder. So it was a double ureter, same like people will have 6 fingers. So the ureters were two. So usually the diameter will be lesser than one. So in such condition, patient already had a operation. So patient told, if you are able to do something, you do it. Otherwise, I am not going to take any treatment. So I told we'll try. So this patient I have treated for 1 year, and it came to the urinary bladder, and just with the help of catheterization, the calculi and it got blocked. When it came down, it was about 16 mm, even into the level of penile urethra, and later it was being removed with the help of just basic 1000 rupees catheter. So one more case, you are able to see obstructive uropathy mid uretric calculus. You can see already one large calculi 23 mm, and there is another calculi in the pelvirectric junction 20 mm, and two larger 15 mm and 6.2 mm in the level in the ureter. So unless the uretric calculi goes out to the bladder, it will block, and whenever the ureter is being blocked because of one calculi, there will be stagnation of the urine in the kidney, and that will lead into more calculi formation. So once it comes to the ureter, it has to pass out quickly, otherwise there may be chance of more calculi in the same side. So I'm putting one picture of the calculi. Even I have got a lot of calculi in my hand. I hope you are able to see. I can show you so that I have almost 20 to 30 calculi are there with me. So if possible, I'll show you later. Right. And usually when the patient is having recurrent calculi, we can send the stone for pathology investigation, chemical analysis, so that we will know what type of calculi it is, so that in future we can advise some diet so that we can prevent its recurrence. So prostatomegaly, one of the commonest cases what I encounter, uh, where the patient will have difficulty in urination. This was the common problem in the textbook after 60 years, but nowadays we see even by 45. Patient will have difficulty in urination, frequency, nocturnal frequency means night time 3 or 4 times, and patient will take more time to empty. And sometimes there will be retention of urine also, where even after urination, some amount of urine remains. And normally, even I put this case very importantly because in this surgical intervention is not at all good. Reason is they cannot remove the prostate because through the prostate only the urethra comes down. So they will just scrape it. So once they scrape it, within 6 months or 1 year or 2 year, surely same like your haircut or nail cut, it will grow faster. So instead of that, if you leave it also, it may grow slowly, but if you cut it, it will become fresh, or fresh wound, surely it will grow faster. So I have seen cases where people have undergone 3 to 5 times same procedure. And when you do recurrently the prostatic catheterization, there may be injury to urethra. It may lead into stricture urethras also, and sometimes incontinence, where the patient may lose control over the bladder. So this and all is risky. So we have got cases, but when you, that's what I have put, know with the differences. Why I am putting this? Because homeopathy has got wonderful result with this. Always, as I told, we should know the prognosis. In such condition, we should, more than the size of the prostate, we should know something called post-voidal urine or post-voidal residual urine. Means how much amount of urine remains after a normal urination, because more the retention, more is the infection, more is the infection, again there may be cystitis, again there may be thickening of the urinary bladder, that may produce more amount of retention. It may lead into pyelonephritis, what we call the kidney infection. It may also lead into ascending infections from bladder to the kidney. It may also lead into calculi formation in the kidney. So always, more than the size, it's more important that how much amount of urine remains after urination. If it was around 300 or 400 ml, after your treatment it has become 100, 50, too good. Above 60 years, 10 ml of post-voidal urine is not significant, but otherwise it has to be 0. I have put here know the differences, because cancer of the prostate and benign prostatic hypertrophy are very close to each other, because symptoms don't vary. The cancer symptoms and basic cancerless or acancerous or non-cancerous BPH we call, symptoms don't vary. So always you have to see that patient don't get back pain, because normally in the cancer it will spread from prostate to the vertebral column, in particular lumbar vertebra. So always you have to see that it don't, I mean, it is not there. At the same time, there is a tumor marker called PSA, prostate specific antigen. Normally it will be below 6, but it can be below 10 even in prostatomegaly, but we have to see that it don't go above 10. And normally above 10 is a sign of cancer. Above 40 is always there is a spread of prostate cancer. So I put here one case, about 71 years. You are able to see uh, multiple hypoechoic lesion in the iliac vessels, 10 to 32 ml, along with prostate non-homogeneous. Non-homogeneous means it's irregular. It's a indication that it may be a case of cancer. So I have checked one PSA. You are able to see it's 9.60, and this was the case of prostate cancer. I am putting one more case, because normal BPH I have got lot of cases. I am putting something different because we should be aware of. Many of the time it so happens that we don't have the idea about the cancer of the prostate. We think that we are able to treat, but at the end of a year or two, there may be a cancer and there may be a spread, where after that it's difficult to treat. And the other system of treatment, they will tell that you would have come a year or two before so that we could treat better. So that should not happen. So always we have to know the risks and we should know its prognosis. I am putting one more case where the patient was about 74 years, and this was also I diagnosed, and you are able to see it was a case of prostate cancer, and whole body scan was been taken, and there was a metastasis from the prostate into the vertebral column and even to the ribs. So we should be knowing that even though there is a prostate cancer in allopathy, there is no surgical interventions also. Surprisingly, what they do, if there is a prostate cancer, what they do is that once they remove the testicle, there is no sperm production. So once there is no sperm production, there is no stimulation of prostate for semen. So for one area's problem, other organ is being removed. Something surprising, but this is the treatment. So I am putting one case of fibroid, one of the easily treatable case I can say, but the commonest, lot of people nowadays, people come with the 33 years with the fibroids. Surprisingly, even I see some cases of cancer even at the age of 35. So always you have to remember that fibroids don't turn into cancerous, but usually the cancers of the uterus usually comes in the cervix and sometimes in the endometrial cancers also. So we should be knowing what is fibroid, types of fibroid, and what is endometrial carcinoma and what is CA cervix. We should be knowing about all these things, then only it is easy to treat. And I have put here commonest, treat if necessary. Why I have put to treat if necessary? Because some patients will come at the age of 48 or 59 or 50 with lot of fibroids, even up to the size of 10 centimeter. But it's very important to know that in such condition we need not cure the patient. Even the patient is symptomatic, like maybe heavy bleeding or maybe pain during periods, like what we call dysmenorrhea. We have to just temporarily manage till the patient completes the menopause, because once the patient attains the menopause, if it is how much large also, uterus is going to shrink. So how much ever big fibroid also surely is going to shrink. So it's a temporary management till the menopause, like a defending system. Without any symptom, patient has to attain menopause. But if the patient is of 35 or 40, surely better to treat, because still lot of time to attain the menopause. One of the common bread and butter of gynecologist, if the doctors are free, they will tell that you come tomorrow, we will remove it. If the doctors are busy, they tell that after 1 month we will try medicine and you come after a month, because their treatment is only either DNC or removal of the fibroid or removal of the uterus. And nowadays, once the patient attains about 38 years, they don't want to remove only the fibroid, because uterus work is already over. They think like that and they remove the uterus, what we call hysterectomy. My teacher was telling that in the cities, lot of people don't have uterus because lot of big hospitals and lot of doctors also. I'm putting one case: bulky uterus, fibroid 2.32 mm, 2.3 centimeter. Patient age, you can see 48 years. In 48 years, you need not cure the patient, you just manage if the patient is symptomatic. If the patient is asymptomatic, just need not do anything. Once in 6 months, just take a scan just to see what has happened. You can see it has become seedling fibroid 2.2 centimeter. Then you can see it has become 1.6 centimeter. And now you can see same patient, normal abdomen or normal uterus. I don't want to tell that all the cases have done this, but you just manage. Once the size reduces, patient don't have heavy bleeding or menorrhagia, and patient don't have severe pain, you just continue. We have to send for surgery if patient is not able to bear the pain even for next cycle, such a severe pain, or patient is going on becoming anemic due to heavy bleeding. If at all patient is going to become anemic, like a month back patient's hemoglobin was 10, after 2 months of your treatment it has become 7, it's surely not a good prognosis, because better to refer to surgery, because if 2 more months you wait, patient may have to give lot of amount of blood before surgery, during surgery, and after surgery. So always, if you feel that surgery is necessary even in future, better to do first only, so that in future patient may develop diabetes, patient may develop some complication. With the complication, surgeries are always risky. But if you feel that we can manage, surely show with the homeopathy. This is one of my favorite field, the ulcers. I feel that best treatment we have in surgery. Instead of surgery, we have got with the homeopathic medicine. I'm just showing you the pictures where the patient has got some ulcer. Usually, a lot of people come with varicose ulcers. Sometimes they come with the diabetic ulcers. Sometimes what we call the bed sores. Sometimes even the arterial ulcers, even with the gangrenes. So this is one case, and I'm showing you second case. You are able to see the size of the ulcer, and you are able to see that white color. It is nothing but calendula dusting powder. Normally what happens in allopathic sector is that, that's what I always tell, that prognosis is very important. uh, in allopathic treatment, daily they will do what we call cleaning. They clean in such a way that even the healthy granulation tissue what has come over also is being removed. So once the patient comes with the ulcer, you might have seen that years together the ulcer don't heal, because they are not allowing it to heal, because they want the ulcer to be very clean. There should not be any one pus point also. There should not be any so-called debris or crust formation. Once it comes, they will remove it. Once they remove, ulcer will remain permanently. So see that once it's a healthy granulation tissue, don't clean it. Keep it open and put some dressing powder so that it will heal better. Allow it to heal. Don't make it more and more deeper by cleaning. So always within a day or two, surely one layer of granulation tissue will come. But normally in allopathy, they will just do betadine or Dettol or antiseptics, etc. cleaning. Yes. So you can see this is a case, and this case completely healed. So this is how, even though it looks bad, ugly, not a problem, it has to heal. You are able to see this is one of the rare case, the ulcer in the heel. In such condition, you have to see that the edges of the ulcers are clean, and if it is very rough and hard, we may have to trim it so that it becomes little bit soft, so that it will heal better. This is the recent case. I think I finished the treatment a month back. I have treated for around 3 to 4 months, and you are able to see this was a diabetic ulcer case. Even the one toe what is being left, they told to remove even from the level of ankle, but you are able to see very clearly it has healed. I'll just take 5 more minutes to show the cases. Later we can have a discussion. This is one of the another varicose ulcer case. I did not get the other picture, and but you are able to see that white areas, all the areas were ulcers, but now it's almost at the verge of healing. And you are seeing that the red color is the healthy granulation tissue. It is going towards good healing. This was one of the interesting rare cases. This was a case of snake bite. But again, I'm telling, though I treat surgical cases, I don't want to tell that I will remove the snake venom. After the snake venom treatment, what we call anti-snake venom therapy, for the ulcer, the patient was asked to do the plastic surgery. And the interesting aspect of this case was this boy was about 22 years, engineering student. His hobby was to catch the snakes. So it was the area of this is the forearm below the elbow, and this patient did not wanted to go for plastic surgery because you need to take rest for a long time. And he came to me. You are able to see this was the first and second picture, and after that the slough went off, and you are able to see very clearly it's a red clean granulation tissue. And remember, this patient never cleaned it, and when he used to come to my clinic, he used to tie with his kerchief. No dressing, no cleanliness. And I have treated this case for around 3 months, and these are the pictures. You are able to see very clearly, though it looks dirty. I know surely the first picture what you are able to see, allopaths won't agree for this because they want all those things to be removed. But you are able to see very clearly it has healed, and this is the last picture. Right. So what's lot of cases? Homeopathy has got the best treatment instead of salicylic acid, even with wherever it may be in the face, or maybe in the palm or sole. Or I have a lot of cases. I can show you anybody's hand that what has gone, but I don't want to do it. But you are able to see this case where even some remnants of it is there in the fingers, just to tell you that it is the same patient. Yes. And ganglion, I was talking about ganglion. What is ganglion? You are able to see this. You need not treat it unless it's a problem. But we have got medicines like calcireflor, rota, rhododendron, etc. And you are able to see same patient, the ganglion is gone. Little bit is there, very little. If you case, it is a schwannoma of the neck, where the schwannoma means Schwann cells. They are the supporting cells of CNS, central nervous system, and patient had a larger one in the neck, and this was almost 50% better. Patient was not having any symptoms. There was only the growth was seen. So I just did one CT scan, and even after my treatment, I have taken it CT scan. It was better. There was no spread. So I told no need of any operations. Okay, hydrocele bit difficult because sometimes it may open up. I'm just showing you one case to show how the hydroceles will be, but we can treat with the homeopathy. It will take about 15 days or a month to show the result. Surely later it will show some. So there I want to conclude. I know I'm not discussed all the cases, but still I felt that in particular fixed time I could discuss something. The last page of mine PPT is treat complicated cases with risks. Means we should take risk, then only we can challenge and we can show to other systems that even homeopathy can do something different. And normally I have seen that when you treat common conditions like cold, cough, respiratory, asthma, or maybe hair fall, or maybe something silly, I don't want to tell silly, but still common things, uh, lot of people will come to homeopathy. But when you treat some complicated cases, surely your name will shine. Not only homeopathy, even people will know that uh, homeopathy can do lot. Because for example, in my place, lot of allopathic doctors refer kidney stones to me, because according to them kidney stones only can be treated nicely with homeopathy. I don't want to give my advertisement that other surgical cases also I want to treat or I can treat, but they are referring, I am treating them. And first importance to recovery than cure. Okay, so always give importance to recovery first, because nowadays n number of doctors are there, and you have got Google as father of everything. So they will search everything, so they will find out the answer. So first, you give some result within a day or two, whatever the serious condition may be. So that many of the time it so happens that when I treat kidney stones, within a 2 days patients will start developing the pain. Patients think that pain has come, so it is increased, but you should know that in renal calculi pain has to come. Where I tell them that it is like delivery. If you don't get delivery pain, doctors will inject injections and to induce the delivery pain. Very similar is treatment of renal calculus. So pain should come. So because sometimes it so happens that once the pain comes, they will go to other system, painkiller, injections, or because once they go there, you know that they won't allow. They will tell that today only we have to remove, otherwise tomorrow kidney will undergo failure. So once people are afraid of kidney, they will, the lithotripsy is being done. So always you have to inform the patient that what is going to happen, treat what is to be treated. This is also something what I have understood in my experience. Though we know that homeopathically, I am telling for the homeopathy lovers also, whenever you go to homeopathic doctors, inform everything and try to get maximum cure or treatment from homeopathy itself. Many of the time it so happens that patients will come for particular conditions. I mean to say, patients may be having asthma, they are on inhalers, they come to homeopathy just for some dermatitis, and they tell that doctor, I am already on inhaler, you treat only my eczema. Though we know that in homeopathy we have to treat asthma and dermatitis together, because both are siblings, allergy reaction, but they don't want to listen to us. They want dermatitis to be cured than asthma, because asthma is not bothering, because dermatitis there in the palm or foot, or maybe in the dorsum of the hand, they are more worried about the skin than the asthma. So in such condition we can inform them that both are both sides of the same coin, but if they don't want to listen, you can treat what the patient has told to you. Many of the time patients will particularly tell you that, doctor, you treat only my right knee joint. For all other things, I am taking some other system of medicine, maybe Ayurveda, some allopathy, or Unani, or naturopathy. So sometimes you can tell holistic approach is what. Sometimes they don't want to listen. You treat only the knee. Badly and sadly, yes. Belief and confidence is very important. Patient should have belief in you, and you should have belief in homeopathy, and you should have highest confidence in homeopathy, along with prognosis and knowing the pros and cons. What bad is going to happen also you should know. You should know its complication and know it and treat it. I will always tell that homeopathy is not slow, even to my students, because if at all you feel homeopathy is slow, homeopathy is not slow, we are slow. Many of the students ask me that, sir, what about homeopathic aggravation? Means suddenly it will go become more and later it will decrease. So sometimes yes, but sometimes imagine a patient comes with 104 fever. What will happen if there is a aggravation? If it becomes 105, what is going to happen? So sometimes we have to be practical. We should know what is the pathology and treat the patient. I will not tell that homeopathy is cheap, never, but it is best. Many of the time people tell that homeopathy is cheap and best. I will not tell that it is cheap, because uh, it has got lot of efficacy, it has got lot of work, and it will do it, and it is surely best system of medicine. I can say that surely 80% of all the conditions, even even present corona also we could treat better. Though there was no scientific, people may not agree. People may not agree is not, does not mean that it is not scientific. Treat maximum cases and spread our system. So treat complicated cases also, so that you become famous. Treat simple common cases also, so that people, more and more people, get attracted towards homeopathy. The simplest, basic, without any side effect, the best system, I can say, uh, in the world. Thank you.
Good evening, all. Good evening, Dr. Manu Bhat.
Yes,
I
good
am
evening.
Dr. Dhanesh. I am Dr. Dhanesh from Alipi.
Yes,
I'm
sir,
a,
please.
I'm a regular visitor at IFPH, and I am
Y-
a part of this promotion team.
Yes,
Uh,
nice
you
to
have
know.
done you have done a wonderful session here, and you have
Thank you.
covered almost all part of the surgical scope in homeopathy. And as you rightly said, it is our duty to propagate homeopathy to the public, whether it is a case of simple case or a big case or whatever a complicated case. And this is
Yes,
what this is the need of the hour, and this is and your demonstration of cases were excellent. You have shown that some of the incurable you are able to cure it, and this is something extraordinary. And it was just your presentation was just like 2020, that you have to cover a lot of things and that in a short time, and you have done the justice in that. You won the game without any fail. And I must say, you have scored a more than century. Like appreciation, you will get. You are about to get such kind of appreciation from all of the participants here. This kind of presentation really will need to reach to the public level. Then only our effort of promoting homeopathy will be in the right direction. So my request to you is that you should come forward in some more cases, some more presentation at our platform, so that all this presentation will be recorded and will be uploaded in the YouTube, so that more and more public will watch this and read this, and they will definitely go to some other homeopath who is
yes,
very near to them. And I have no words to express my thanks on behalf of our AFH team and as well as myself. But I have experienced this kind of things, and as you told, the you must talk about the policeman and the police station. Just that's when we consider the glands, the glandular system, almost all glands are just like police stations, and where the unwanted
antigen antibody
fellows are.
reactions happen.
Yes, yes, they are put in there, and gradually these things are entering into the heart, and otherwise the heart may burst it. And so these are the protective measures which protect, just like police station. The police people, they are giving protection to the people all over that area. That is the most important. Every local area we have a police station, just like
Yes,
every local area, there is a lymph node, a lymphatic gland that protects us from uh, problems of severe illness. So the so-called new people, the modern people remove this thing, and most of the people nowadays having the now such police station in their
yes,
area, and as a result, they are suffering a lot. But people are not aware of these things, and this kind of presentation definitely will reach need to reach the public, so that they will know what is happening with the other system. Just like as you told that when you remove the fibroid, the most of the fibroids are removed in the cities rather than in villages. And
yes,
nowadays, the people from villages also going towards this kind of city hospitals because of the
yes,
fame and better, good number of doctors available there. So it is our duty to know the people that we have our tools with us. We have wonderful medicines with us to cure those kind of patients. And thank you once again to all. And thank you, Dr. Manu. It's a very good
Yes.
presentation. I hope you will also join us in the coming month or so.
Sure.
And when you get
Absolutely.
time, definitely you should come forward, and we
Yes.
hope so. Thank you
Yes.
very much.
Thank you so much. Thank you so much. And yes, please.
I
Yes,
think Mr. Velappan Pilla, you can now participate in the discussion.
Yes,
Velappan Pilla, please.
surely. I have time.
Okay.
Okay. Thank you all. Thank you all the participants. Thank you, Dr. Manu, for your fantastic presentation. And I'm not a doctor. Even then, I could understand. I have got an idea about the common diseases because of your simple way of presentation. Thank you very much, Doctor.
Please, I have given the list of diseases so that common people should not go for surgery in these kind of conditions. Wherever nearby homeopathic doctors are there, please visit. And the doctors also, those who are participating, I am always telling, know the prognosis and know the pathology, because simply blindly don't treat, because many of the time it so happens that we tell that we have got treatment and later we fail. Reason is we are not able to understand what is happening. So always people should come forward for this type of treatments, and at the same time doctors should also have been responsible in treating it.
Yes, that is very clever idea. So good. Then now,
Okay, thank you, Doctor. Thank you, Doctor.
Okay, thank you, sir.
But I request you to give publicity for your experiences so that the general public will be knowing. Thank you. All the best, sir, Doctor.
Yeah, thank you.
All the
Because
best.
I'm teaching in the Alvas Homeopathic Medical College from last 12 years, and my students are also able to treat much better cases. Even there are some people in CCRH, there are some people who are in the government sector able to treat better than me. That gives me more happiness. But I always tell even my students that know everything about every condition so that you don't fail, and you should know what to treat, you should know what not to treat. For example, like neurofibroma or lipoma need not a treat. So in such condition, we need not jump and we tell that we have got a treatment in keloid conditions, etc. Because it is difficult to treat. So what is out of all 100 cases or 100 diseases, 80% are our bread and butter. I think that's surely more than enough. Leave 20% for other system of medicine. You need not grab their 20%.
Oh yes, good.
Okay. Thank you.
Farid Bawakan, sir, please. Farid Bawakan, sir. Farid Bawakan, sir.
Okay. Am I audible?
Yes,
sir.
Dr. Manu Bhat, good evening.
Yes, sir. Good evening.
From the bottom of the heart, congratulate you for the excellent presentation today. Your presentation helped me a lot to widen the perception about homeopathy. I am not a homeopath. I am a homeopath lover.
Okay. Yes.
I hope this would help or serve as a guide for other homeopaths also. That's not a small thing, it's a good thing. It's clear that the financial health of people will be positively impacted by avoiding surgery.
Absolutely.
Very great.
Absolutely. 1 second, because nowadays I always tell with the renal calculi patient that your room rent of 5 days of hospital, in that money we can remove the stone. Forget the OT bill, forget the tablets bill, forget the doctor's bill, forget the anesthesia bill. Just by room rent of the hospital, in that money, what we call around 5,000 rupees, we can cure it. That's the reason I did not talk more about the medicines or remedies. Reason is there are many people non-homeopaths, including Mina. So I did not wanted to discuss about homeopathy medicines, but I could show you that these are easily treatable with the homeopathic medicines. Yes, please continue, sir.
It's a great thing, no doubt about that. This should reach the people. Then only that people can make use of this facility. Definitely, we should have some way to reach the people of the country. I don't want to prolong my words. All the best.
Thank you.
I think you will come again with the more presentations and all that, so that we will be able to understand more about the homeopathy. Okay, thank you. All the best.
Thank you, sir, for your valuable participation. Now, please, I am Dr. Adnan sir, the former DM of Adnan sir, please.
Thank you, sir, for your wonderful presentation
Thank
on
you.
surgical cases.
Thank you, sir.
Dr. Manu Bhat, although you are junior, you have done very good job in writing surgical cases. Many of the cases that appear before us can be treated by non-surgical measures, by homeopathy treatment. Apart from that you have mentioned, I am to state some few cases which homeopathy has much scope. They are keloids, fungal, pterygium, nail deformity diseases, and including toenails, paronychia, nasal polyps. Such disorders can also be well treated by home treatment.
Very true.
Many surgeries could be avoided by timely intervention and surgical management also. What I meant is dressing, surgical dressings and packings and poultice and everything of that sort.
Yes.
But we could manage pterygium. I would 10% result is got on pterygium.
Yes.
It should have taken, I think, not more than 2 months, 1 or 2 months for complete recovery. 10%.
I will add it, sir. Surely. Yeah, very true. I have treated few.
Okay. That's such cases also maybe tried.
Okay.
Yes.
And all the best wishes from me.
Yes.
Thank
Thank you, sir, for your participation. Thank you, sir. If anybody is there to ask questions, please go to the participant box list and raise your hands, please. Okay, sir, please continue.
One sentence. Yeah, actually, after Corona, I could get much more surgical cases because a lot of people who were going for cities for big hospital surgeries for last 1 year because of Corona, they could come to homeopathy also because of Corona fear and the bill. So that could help homeopathy to treat them better. So actually, after Corona, lot of people, extra people come for homeopathy because of, not because they want to take homeopathy only, but because they are afraid of hospital admissions, Corona, and the fees which has increased after the Corona, the bill. So after that, I have got more cases, actually speaking, after this last 1 year. Reason is people don't want to go for hospital, where people used to go for, even for basic simple cold and cough, people used to go for big hospital, but now they don't. But it will take around a year or two. Again, the same old pattern will continue. That's a fate of our place.
Anyway, what is important is runs just like in the cricket we say, what is how they comes is not a problem. Runs are important, just like that. Now I am calling Dr. A.C. Gupta, please.
First of all, I would like to congratulate Dr. Manu. It was a very nice presentation you had given.
Thank you, sir.
And precisely about the so-called surgical cases by those other people, and quite a good number of them are very well treated with homeopathy. But I just would like to know from you that have you got any cases of urethral strictures also? Strictures?
Yes, sir.
So, what had been the experience in that?
Normally, for urethral stricture, the common cause either either there be an injury or impacted renal calculus where it remains for a long time, leading to stricture formation. Even it can happen due to tuberculosis. These are the three common conditions which usually lead into stricture ureter, even stricture urethra also. For stricture urethra, even repeated catheterization due to various reasons is also one of the reasons. So usually I have treated, if at all it's asymptomatic, need not treat, but if at all there is usually problems will come, will have once in a 3 months or 2 months, they have to dilate it. So in such condition, homeopathy and calcare fluor, these are the medicines, including some other tinctures, have worked out. So that I have seen a lot of cases. Once in a while, it may not work, but otherwise, where people had undergone repeated dilatation, they have stopped. For those who used to take once in 2 months, it has become once in a year. I think that itself also is something